morning, and welcome to Complete Health with Dr. Mike Rogers. I'm your host, April, and today, while Dr. Rogers enjoys a well-deserved day off visiting with his son, my special guest is our hygienist, Laura. Laura graduated from Luzerne College with a degree in dental hygiene and has over 30 years of experience as a hygienist. She has worked at Complete Health Dentistry of NEPA for the last 8 years and continues to take over 20 credit hours a year of continuing education in her field. I have invited her today because October is National Dental Hygiene Month. This month, we celebrate the work dental hygienists do and help raise awareness on the importance of good oral health. What better way to accomplish that than have our very own hygienist join us on the show? Good morning, Laura.
Good morning.
I wanted to begin with the fact that we know that continuing care or cleaning appointments are important. Evidence has shown a link between the bacteria in your mouth and many other health risks, the most severe link being an increase in heart disease. At Complete Health Dentistry of NEPA, your total health is important to us. Laura, can you explain to our listeners how a recare visit is not just a cleaning, it's a lifesaver?
Yes, I would love to. This is what I love about working at Complete Health Dentistry of Northeast Pennsylvania. When a patient comes into our office, we do a very extensive exam and we do a very extensive cleaning. And part of that involves taking a plaque sample. I'll explain what the plaque is in a little bit, but we take a plaque sample and we put that under a microscope. And we're able to see this bacteria that's going on in their mouth on the big screen. And that bacteria is not necessarily a good thing to have in your mouth. Now, yeah, we all have some bacteria that's supposed to be there, but the majority of the bacteria that's going on in the mouth is bad. And that's why people have cavities. That's why people have gum disease. And that's why people have a lot of other health issues going on. Now, we may have known somebody or you yourself, sometimes patients will have a prosthetic joint, like an artificial knee or hip, or they have issues with their heart. So they're told by their orthopedic surgeon or their cardiovascular surgeon that they need to take antibiotics prior to their dental treatment. People don't know why they're doing that, but this is why. They're doing it because that bacteria, that bad bacteria is in their mouth. It gets picked up by their bloodstream and travels to that compromised area and can cause it to fail. But what they don't realize is that bacteria is getting picked up in your bloodstream all the time, not just when you're going to get your teeth cleaned, not just when you're having a procedure. That is pumping through your system and compromising your heart, your joints, your lungs. It just is not good to have that all over your system like that. So what we do when you get your teeth cleaned is in our office, we help you eliminate that bacteria, not just disrupt it and have it gone temporarily. We help you eliminate that bad negative bacteria so that you can be healthy. Your whole system can be healthier.
And we're going to talk about that, what to do if you have that bacteria in our next segment. But right now, can you tell our listeners what can they expect during a dental checkup?
Well, when you first come in, we review your medical history. We will go over what you've already told us about, and then we'll ask you, are there any changes in your health? And some patients just routinely say, no, there's no changes. But we ask you again. We say, have you been to the doctors since you were here last? And sometimes the patient will say, yeah, I have. And then I say, well, okay, are you on any new medications? Are there any changes in your medications? Because sometimes the patient won't realize that they're on a medication that might affect their dental treatment, their whole health, even in regards to their dental treatment. Sometimes they will not realize that an issue that happened to them, say they broke a bone or they had a new diagnosis, they don't realize that will affect their dental treatment, and it does. We also
I know there's medications out there that can cause dry mouth, right? And that affects their dental health.
Yeah, people don't realize that. A lot of antidepressants, a lot of medications for high blood pressure, it decreases the saliva flow. And if your saliva flow is decreased, that plaque is going to stick on your teeth better and help you have a lot of bad problems in your mouth. So it's good to know, because then we can make recommendations to help you not have dry mouth.
And what about the blood thinners, Laura?
Okay, so that's a big one, because a lot of patients are concerned about their blood thinner when they come in for their treatment. In the past, years ago, the patient would be recommended to go off the blood thinner for about 3 days before any dental treatment, and that's not the case now. The studies are showing that it's more detrimental to the patient to go off that blood thinner than to have their cleaning done. Now, the problem with the blood thinners is that patients will think that their gums are bleeding because they're on the blood thinner, and that is not the case. I mean, they're more likely to bleed because of the bacterial infection that's there, but patients that are healthy, patients that don't have a bacterial infection in their mouth, they're not going to bleed when they get their teeth cleaned. They're only going to bleed if there is that bacterial infection. The Coumadin or the blood thinner, the warfarin, that will make them more likely to bleed, but they won't bleed because of it.
So the bacteria needs to be present to cause that.
Yes, the bacteria needs to be present. We also, I mentioned we do the plaque sample with putting it under the microscope so the patient can see what's going on. This is literally an eye-opener. So after we go over the medical history, we will always take your blood pressure. We take the blood pressure on every patient over age 18. And we do this because the patients will come to see us, any dental practitioner, more often than they see their general practitioner, their physician. And when we take the blood pressure, it gives us a lot of information. If you're already taking blood pressure medication, a lot of times we'll let the patient know whether that blood pressure medication is effective or not. Sometimes patients have to try different types of medication to get it right. We've referred patients back to their physician, and the physician did indeed change the medication that they were on. We will also take their blood pressure because sometimes if the pressure is too high, that will make a difference on what type of anesthetic or numbing agent that they're going to get. We also examine the patient to see when their last. We also review their history on what x-rays the patient has in the past and what they are due for. Now, I hesitate to say what they are due for because you don't really like to take routine x-rays just to take x-rays. I mean, that's not what we do in our practice. However, we will look to see when you had them last. Most routinely, there I am using the word, most routinely, the x-rays once a year are called Bitewing X-Rays. Those x-rays are specifically for looking for cavities in between the teeth and checking bone levels. It also shows if there's any tartar buildup in between the teeth, checks the fit a lot of times to see how that crown or those bridges are holding up. And it is really, really critical. I've seen patients not want to have these x-rays. I've been in dental offices that don't take them every year, and it's really not a good thing to let that go. You can find a small problem that is going to save that patient a lot of money in the long run if you catch it early, and it's also going to save them a lot of pain. And once again, that bacteria that's working on that cavity is in their system, and it's not healthy in the long run.
And these x-rays are to see things that we cannot see with the naked eye. Right.
They're of the back teeth. Typically, there's 4. And the front teeth are more readily visible because they're in the front of the mouth. They're easier to see if there's something going on there. Well, the back teeth, especially, like I said, if there's crowns, bridges, they're hard to see underneath of them. And it's just so much better to take that x-ray. And the radiation level is so low. That's the biggest concern that patients will say. They're like, oh, I don't want that radiation. It's so minor. The daily life gives the patient more radiation than what they're getting from those yearly Bitewing x-rays.
Right. You get more radiation from an hour in the sun or riding in an airplane, correct?
Mm-hmm, right.
So one of my favorite things about having cleanings done at our office is that Dr. Rogers allows us to schedule a minimum of a full hour with every patient. I know it's not something they rush in and rush out to do. We're very thorough, and you've told me in the past that you love that about our office, that you get a full hour to do, because it is a lot of things that we do with the patient.
I do love it, and that's one thing that the patients compliment us on the time. I had a patient compliment me today on that. He said, I'm never rushed during my procedure, and you pay attention to what's going on. You're very thorough. We are not an assembly line type dentistry dental office, and we really give the patient the time they need, especially if the patient is nervous.
So you're listening to Complete Health with Dr. Mike Rogers. When we come back, we will continue our discussion with our special guest, Laura, about why it's not just a cleaning, it's a lifesaver.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome back. So Laura, before the break, we were talking about what you can expect during a dental checkup, and we only scratched the surface. So I thought we'd go back and talk a little more about that.
Some other things that we do is an oral cancer screening. We do that with traditional methods, which is looking in the mouth and palpating, which means feeling on the outside of the mouth, around the head, your jaw joint, and
What's the difference, Laura, between what we do looking in the mouth and what my primary care physician does?
well, when you come to the dentist, we are very focused on the mouth and the supporting structures of the teeth, which is the jaw, the muscles of the jaw, and we will do a very thorough screening. Sometimes we use an instrument called a Velscope. A Velscope is a tool that utilizes a high-intensity filtered white light. And with this Velscope tool, we can sometimes see something that we might not normally see under white light. It's kind of, if you've ever watched those crime shows where they walk into a room and everything looks normal, and then they turn off the lights and they shine that light and they say, oh my goodness, what happened here? Sometimes that's what it is like in the mouth. We don't want to see that because that means there's a problem, but sometimes when you just look with your eyes in a normal light, you can't see it. Now, patients will say, well, is there radiation involved in this, or what's the damages? It's just simply a high-intensity filtered white light that puts a different view on it. When you go to your physician, they kind of like look in your mouth, look in your throat, make sure you're not red or you have post-nasal drip or things like that. But we really are very specific and pay attention to it pretty well. We also screen for sleep apnea. Now, that's something that we will refer you to your physician for. It's a simple one-page questionnaire. We ask you some questions about snoring and stopping breathing during your sleep. And then if we see that you have the signs and symptoms of sleep apnea, we will give you a referral to your doctor. We also check your existing fillings to make sure that they're not breaking down. And we also look to see if you have any new cavities. We will also evaluate your bite and look for the consequences of missing teeth or crowded teeth. One of the most important things we do is do a very thorough gum exam. We will take a special instrument called a periodontal probe. It's a dental ruler, and we will measure 6 points on every teeth, 6 points of a little valley that's around the tooth. It's called a sulcus, and no matter how big or how small you are, a healthy, normal adult, that little valley, that sulcus around the tooth is 3 millimeters deep. If we see any measurements above 3 millimeters, we're going to talk to you about what's going on there and how you can treat it. Typically, 5 millimeters and over is considered periodontal disease. Periodontal disease is the breakdown of the supporting structures of the teeth. So it's the bone and the ligaments that hold the teeth in. And a lot of people think that as they get older, it's expected that they lose their teeth. And that's not true. People lose their teeth because they've had periodontal disease for a long time. That bone has been quietly breaking down and their teeth become loose. The older generation, they called it pyorrhea. Normally now you'll hear on some commercials, gingivitis or periodontitis. Sometimes when you go to your physician, they would check your cholesterol levels to help prevent heart disease. And now everyone is screened. At our office, we screen everyone for gum disease. I was talking to you earlier about putting the bacteria up on the screen. It goes under the microscope and goes on the screen. We'll do that for children too. You'd be surprised at the bacteria levels you see in children. And it's very sad because now they're going to have that bacteria all that time, all those years, and not getting that out of their system. And that's something that chronically happens and starts breaking down in their mouth and spreading through their blood system. So
we did a show on that not too long ago, and I know explaining to parents that bacteria can be passed from one person to another. Parents of very young children cleaning a pacifier off in their mouth or blowing on their baby's food, right?
I'm actually over here shaking my head. Yes. What happens is children are born without the bacteria in their mouth to cause cavities or gum disease, and they catch that from somewhere, and that's usually their caregiver. Other things we do in our office is we will evaluate your cosmetic needs. Somebody will come in and they'll say, I don't like this about my smile, or I want whiter teeth, or, we can certainly address all that.
What if I have a denture, Laura, and I come in for my cleaning?
Oh, and you come in for your cleaning and you have a denture. If you have partial dentures, we will clean the partial dentures for you and evaluate the fit of those dentures. Sometimes they're not fitting properly, and that will trap plaque and help cause a cavity. Sometimes if it's not fitting, rocking side to side, that helps loosen your teeth. The looser your teeth are, the more likely they are to fall out. And if you're already missing teeth and wearing a partial denture, you really don't want to be losing any more. If you have full dentures, that is really important to see your dental professional at least once a year. And people will get a denture, they'll get their full dentures, and then they disappear off the face of the earth because they think that they're fine. And the tragedy of it is that a lot of times there can be something going on, a denture sore, or we've seen cancer develop because the patient just did not come in to have that evaluated, and they don't know that it's happening. So they come in, we clean the dentures, and we do that full oral cancer exam. We also use a disclosing solution. A disclosing solution is a vegetable dye. A lot of people remember it from when they were children. They would chew the tablets, and this shows us where that plaque is hiding, where we might not normally see it. Plaque is really invisible unless it gets thick and heavy. So when you come in to get your teeth cleaned, we want to get all that plaque off your teeth. So we use the disclosing solution to find it. We'll remove the tartar, we remove the plaque. We'll also remove stains from your teeth, stains from coffee, tea, tobacco. Your teeth will be polished, and they'll be nice and smooth and plaque-free, and we also floss them. Sometimes during the visit, most often we do this, we will take an intraoral camera. Intraoral means inside your mouth. It's like a little wand. And we'll look around your mouth with this intraoral camera, and we'll show you things that we're seeing. And that way you can be an active part in your treatment plan. If we'll show you that filling, and we'll say, look, see how that's breaking down. And you can see what we're talking about. So it's not just a surprise to you, or you're not sure why we're recommending that. We also recommend fluoride treatments for all our patients, adults and children. It's been my experience, even though it's always recommended by the professional and by the profession, it's been my experience that the patients that are getting fluoride treatments when they come in for their hygiene visits are the ones less likely to develop cavities. And there's also some evidence that people who get fluoride treatments have less of a bacterial load. So there's a couple benefits to that. We develop a treatment plan for you, and we can also develop a long-term treatment plan for you depending on what you're able to do and what is most necessary. And we will also educate you thoroughly on what your treatment entails and the technology that's available to perform that.
My favorite part about our practice is that Dr. Rogers does all the procedures under one roof, so there's no need to refer. Now, Laura, what if I know I need to go to the dentist, but I am afraid, even for a cleaning?
Well, that's what I really love about our office, besides working to get the patient healthy or keep them healthy. We provide a lot of relaxing items or things that help them be at ease. We have easy listening music, but some patients don't like that. And we've been known to change the radio station or change what we have on to make that patient more comfortable and what makes them relaxed. We have padded chairs because some people, their backs are hurting them. So they come in and we give them a padded chair, or we even have a back massager that we can put in right behind them on that padded chair. We give warm neck wraps. We have warm blankets. We have aromatherapy. The aromatherapy is amazing. It really, really works. And people come in and they're nervous and they're scared, and we'll put on some lavender or a lavender mix of essential oils, and it just makes things go a lot easier. We will even dim the lights down or put an eye mask if they request it. We actually have a beverage center, so you can get yourself a cup of coffee or tea or even hot chocolate. We supply lip balm from Hawaii. It has sunscreen on it. It's wonderful. We have Bose headphones, so if you wanted to listen to something specifically or you wanted the TV on, we could give you headphones for that. And a lot of patients are nervous about the actual cleaning. It's going to hurt. And we do our very, very best to offer different types of desensitizers. We can put a desensitizer on the gums. We can desensitize your teeth with a special polish before the procedure. I know myself, I have to have that desensitizer before my teeth are cleaned. And it really makes a huge difference.
Thank you, Laura. You're listening to Complete Health with Dr. Mike Rogers. When we come back, we'll continue our discussion with our special guest about why it's not just a cleaning, it's a lifesaver.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistryOfNEPA.com.
Welcome back to Complete Health with Dr. Mike Rogers. We're here today with Laura, who's our lead hygienist at Complete Health Dentistry. When Dr. Rogers diagnoses a patient with periodontal disease, we offer non-surgical treatment called adaptive periodontal therapy. Can you explain what that is?
I'm very excited about the adaptive therapy program that we have at Complete Health Dentistry of Northeast Pennsylvania. I feel it's truly what a dental hygienist is meant to do. So when the patient's diagnosed with periodontal therapy, the patient is diagnosed with periodontal disease, and we will have already looked at that bacteria under the microscope. And we need to get that bacteria out of there because that's what's making the patient unhealthy. So we have this series of appointments. It's typically, depending on how severe the patient's condition is, it's typically 3 visits. It encompasses their visits, laboratory testing, and the patient's supplies. And it is amazing. And the patient can see their progress as we're going through this. They take responsibility for their health, their dental health, and their physical health by doing the treatments at home. And it's just really, really exciting to watch this process.
So we create a team between us and the patient.
Exactly. I tell the patients all the time, I'm not here just as a provider. I am here as your partner in health. So, we're all human beings. The patient might come in and they say, I haven't been doing this. And I say, hey, you know what? That's okay. I didn't feel like doing it last night either. So, we are a team and we work together and we find out what's best for the patient and how that can be accomplished.
So if I have periodontal disease, why can't I just get a regular cleaning? Why do I have to do this other treatment?
Sometimes if a patient has periodontal disease and they come in for a regular or routine cleaning, it actually can make the condition worse. It can be, we talked about that, it can get picked up in that bacteria can get picked up in the bloodstream and go through their system. There's been situations where a patient comes in with severe periodontal disease, and we will not touch them until they have antibiotics in their system for a couple days because that bacteria is going to be stirred up. It's going to be going through their system. If they have periodontal disease and we just try to do a routine cleaning, that's going to be painful for that patient. And this is why a lot of patients don't go back to the dentist. They have a horrible cleaning because they have a disease in their mouth. They have a painful situation. Think of it like if you had splinters all over your hands and they were all removed at one time without any anesthetic or anything, that would be very, very painful. And this is what patients are going through. They have tartar, which is like splinters. They have tartar under their gums, and it's just not going to be removed, and it's not a healthy situation all the way around.
So for a traditional cleaning, we don't go below the gums, correct?
A prophylaxis is what it's called, and a prophylaxis means a preventive procedure. And only if you're healthy are you really to be having a prophylaxis dental hygiene appointment. So what what we're doing and during a prophylaxis is no, you're not supposed to be going below the gum line because that's not what the procedure is. But if you have periodontal disease and that's where that tartar and that plaque is, where that bacteria is hiding, you need to get that off, because a lot of patients throughout my entire career say, I just want a cleaning. I don't want this other stuff. Well, you know what? You don't need a cleaning. I mean, you need something more to be healthy. I would hate to see a patient come in. Our whole philosophy in our practice is the patient shouldn't come in and just get what they think they need. They should be educated on what they really do need.
So I know a lot of our listeners have this question. I brush my teeth twice a day. I floss regularly. I take good care of my teeth. Do I even need to go to the dentist?
You know, it a lot of times it really breaks my heart to see somebody who is really doing everything they're supposed to be doing and still have issues. You know, I've seen it my whole career. Oh, I brush my teeth every day. I floss every day. I always get a cavity. My gums are still bleeding. And they get very frustrated because basically the hygienist is beating them over the head about flossing, and they are flossing, and they just are very frustrated. They don't want to hear it again that they have this issue because they're doing everything that they're supposed to be doing. And that's where it comes down to. It's a bacterial infection. And no matter what they're doing, that bacteria is not going away without the proper therapy. You know, I put my plaque slide under the microscope and I saw some bacteria and I was horrified because I'm a hygienist. I know how to clean my teeth. We have to understand that this is a bacterial infection. We catch this from somewhere. So it's not necessarily that you're not clean. It's not necessarily that you're not doing what you need to do. We all get sick. We all catch a cold. That comes from bacteria. Those are the things that make us the sickest. And sometimes we don't see it. We don't know where we got it. But here at our office, here at Complete Health Dentistry of Northeast Pennsylvania, we know how to treat that. We can fix it. And it works. I see it every day.
So I know we talked about some of these, but what are some signs that you should see a dentist?
Well, if you're not going to a dentist already and you have any of these symptoms, I hope that it motivates you to go. If your teeth are sensitive to hot or cold at all, if you notice your gums are puffy or they bleed when you brush or floss or spontaneous bleeding, like there's people that bite into a sandwich and they'll see that there's blood on the bread. That's a problem. If you have fillings, crowns, dental implants, dentures, any of those things, those are things that aren't natural in your mouth, and they're going to collect plaque, and they're going to be they're going to be more compromised than if you had your natural teeth. If you don't like the way your smile looks or your teeth look, you have persistent bad breath, or you have a bad taste in your mouth. If you're pregnant, years ago people used to think if they were pregnant they shouldn't go and get their teeth cleaned or examined. No, you have to, because there's that bacteria in your mouth that could compromise things with your pregnancy. If you have any pain or swelling in your mouth, face, or neck, if you have trouble chewing, swallowing, if you have a family history of gum disease or tooth decay, if you have any medical condition like diabetes, cardiovascular disease, which means high blood pressure, heart disease, stroke, stents, asthma, arthritis, any eating disorders, HIV positive, any health issue, it's really, really important that you have your mouth checked too. Your mouth may be dry. Come see the dentist then, because you could be just having issues with that caused by the dry mouth. If you smoke, use other tobacco products. If you're having any medical treatment like radiation, chemotherapy, hormone replacement therapy, if your jaw pops or is painful when opening or closing, chewing, or when you first wake up, or you feel like your bite is uneven, or if you have a spot or sore in your mouth that doesn't look or feel right and it's just not going away.
Thank you so much, Laura. You have been listening to Complete Health with Dr. Mike Rogers. I want to thank our special guest today, Laura, for sharing helpful information as we celebrate National Dental Hygiene Month. I'm so glad we have a month to celebrate you and all you do for the profession. For more information on this and many other topics, please visit our website at CompleteHealthDentistryOfNEPA.com. Once there, you can listen to our past radio shows.